Well, if you really want to try to prevent the disease clinically from occurring, in other words, prevent memory loss and other thinking problems, then you have to screen people that are normal, cognitively normal. So there's tests that we can detect that, for example, the proteins that accumulate in the brain, such as amyloid and tau, we can detect those pre-symptomatically with imaging studies called amyloid imaging. Now there's a new imaging called tau imaging. And also spinal fluid tests can allow us to detect that that's going on even in, up to 20 years before symptoms start. You actually measure the proteins that are accumulating, just kind of like, it'd be like somebody who, let's say you're a normal person who's a 50-year-old man who's normal. If you did like a stress test on their heart or an angiogram, you could determine whether somebody has atherosclerosis in their coronary vessels. Same thing here. You can detect whether amyloid and tau are building up by these tests. And we know that if certain changes are taking place, we already know from following people over time, their risk for becoming impaired is very high over a certain period of time. So we're at the same stage now in Alzheimer's disease as the atherosclerosis field was, say, 20 years ago, where they had the same issue. I mean, just because you saw the atherosclerosis, no one knew if you gave a cholesterol-lowering drug, it would, let's say, prevent a heart attack or prevent strokes. Now we know through trials that they did, and now you just have to get your cholesterol measured, and you say if it's too high, then you take the drug. Hopefully in the longer run, maybe 5, 10, 15, 20 years from now, it'll be the same thing for, however long it takes to do these trials, assuming something works. Yeah. Well, there's an incredible amount of studies that are done before these different agents go into humans. So not just safety testing, but they determine in animal models whether the biological therapies or small molecules are actually doing what you think they're supposed to do. So when they go in, it's not, sure, you need to do a trial and error in a human, but it's based on a lot of, often years worth of knowledge that you've done before you even go there. There are things which probably do help for sure. It's not that they've been tested in rigorous studies, but there's a lot of retrospective and some prospective studies suggesting that certainly social engagement is critical. Getting 20 minutes of exercise a day is really important. Staying good diet, all the kind of heart healthy things that you do are really important for this disease, not just for heart disease. So those are things that a lot of people aren't doing when they're diagnosed, and so those are things that really can help the patient do better for longer. Getting the appropriate amount of sleep, getting regulated sleep, those are really important.